Welcome back, everyone. Today we've got our first orthopedic surgeon on the show, our first orthopod, Dr. Hooman Eshraghi. Welcome, Doc.
Thank you very much.
I have pronounced it correctly.
Perfect. Yeah.
Perfect.
Yeah.
Yak and I have something in common besides being family members and cousins, that, like we were telling you. Both of us have had our bones cut into in the last 2 or 3 years. So I guess orthopods are close to us, specifically.
Yeah, and also we both have had specialist orthopedic surgeons as well. Yash being into feet and me with my hand. But we'll get into that. My orthopedic surgeon, Dr. Roger Nicholson, also has agreed to come onto the podcast. So it would have been great to have both of you on here, but who knows what would have happened then.
Hooman, welcome. Sorry for all that rambling.
Thank you very much.
Thanks so much for saying yes. What does an orthopedic surgeon do?
So an orthopedic surgeon is a medical specialist who specializes in treating bones and joints. That's basically
in a nutshell.
Yeah.
I mean, you guys have a reputation among the specialities for being like the bone crushers, and I don't know if it's a stereotype or what, but am I right? I've seen it in like medical humor. They like these guys just break bones.
It is true. We all basically start as holistic doctors, and after a while we somehow go into our own field and own specialty, and unfortunately tend to sometimes forget about the rest of the body and just focus on the bones. But it's usually a joke. But there is some truth to it.
When you were growing up, did you always know that I'm going to be an orthopedic surgeon one day, or?
It's actually interesting. I always knew I was going to be a doctor, and I always wanted to be a doctor. But I remember the day that I fell in love with orthopedics. So it's an interesting story. Like I was a medical student, and I was working at Baragwanath Hospital in the theater complex, and I walked past the orthopedic theater, and I saw one of my colleagues, he's a colleague now basically, who was doing a hip replacement, and the door was open. So I looked inside the theater, and I saw all the gadgets, and he was doing a hip replacement. So there were like lots of stems and basically orthopedic tools, and I was like, wow, this is cool. This is cool. This is like essentially being a kid and playing with toys, and you're doing your job at the same time. So I knew from that minute that I wanted to be an orthopedic surgeon, and I never looked back.
Well, you said something interesting that piqued my interest, actually. You said you always knew you wanted to be a doctor.
Mm-hmm.
Like, when is the first memory for you of, I want to be a doctor?
So I've got 2 older sisters, and my elder sister is 16 years older than me. So
okay, it's a big gap.
Yeah, it's a big gap. And so I've got a younger sister as well, who is also a doctor. And the 2 of us, I think we just looked up to her.
She was a doctor also?
She's a doctor now as well, yeah. Okay. So the 2 of us were like, when we grow up, we want to be like our older sister. So since childhood, we always wanted to be a doctor, yeah.
Okay, so Doc, we don't know each other.
Yeah.
Yash is obviously your patient, if I'm allowed to disclose that. But I'm going to delve more into trying to get to know you. So I detect a bit of an accent.
Yeah.
You want to tell us more about that? Where are you from? Where did you grow up? How did you end up in South Africa?
Right. So I'm originally Persian. Obviously, Persia doesn't exist anymore, so it's essentially Iranian. And as Iranians, we like to call ourselves Persian. It was the Persian Empire and the all the good things about the history, essentially, and the culture and everything else around it. So I'm a Persian. I was born in Iran, and I grew up in Iran, and I moved to South Africa when I was 17 years old with my family. So just why and how I ended up in South Africa. Um, Again, it's a long story. I don't want to bore you, but essentially we were religious minorities in Iran, and there was a lot of religious persecution about our religion. We are Baha'is, belonging
Okay.
to Baha'i faith. And unfortunately, there has been a lot of persecution. And to this day, there is a lot of persecution about the members of the Baha'i faith. So as Baha'is, we were not allowed to go to have tertiary education, essentially, amongst other persecution. So when I was finishing high school, we had to have a plan. And we had lots of relatives in South Africa, and my older sister, the one who was a doctor, and aunts and uncles, and they were all living in South Africa. So we ended up coming to South Africa in '96. Yeah. So
Yeah, so don't worry about boring us. These are the granular details that we're actually interested in. Just to tell you, I'm from Pietermaritzburg, actually, and there's quite a big Baha'i faith and following in Pietermaritzburg for some reason. We had quite a few Baha'i students at my high school, Rezvan Mani.
Yes.
Do you know Rezvan?
Yeah.
Oh, wow. Okay.
Yeah.
And he was quite big into the Baha'i faith.
Yes.
The first time I came across people like Baha'i people was when I started studying my undergrad dental degree at University of Pretoria. And, it's the first time I'd come across Persian people, Iranians, or Iranians, I don't know how you pronounce it. And funny thing is, quite a few medical doctors, like the Shamses, Mariam Shams, and then you probably know all of them also. So I didn't know yet that there was a Baha'i community in Maritzburg.
Yeah. Well, I don't know what's the congregation called. It wasn't a church, but they did have a place of communal
Place of worship.
Place of worship. I'm not sure
Yeah.
what it was called, but the way Rezvan explained it to me the one day when I asked him, because he originally came from the States, was that they take the best out of every religion and it's kind of incorporated into one sort of unicultural practice.
Sure.
Was that the correct interpretation?
Sure. So Baha'i faith is an independent religion. It's a very peaceful religion. It originates from Iran. Our prophet was born in Iran, and it's essentially, we believe that all the religions come from the same God. The social teachings change, but the essence of all religions is essentially the same. So we believe in unity. We believe in essentially unity in diversity is one of the main principles of Baha'i faith that's become a lot more relevant these days. Especially in South Africa, you hear it a lot more. Essentially, comes from Baha'i faith, but the social teachings with all the religions may differ, but essentially same God. And depending on the need of the time, we believe that the religions change and the teachings essentially, become fresh. So that's essentially it. But
so it's a very adaptive religion.
It's unfortunately there is a lot of persecution in Iran and in essentially Middle East about the if you're not part of the majority, there's a lot of hardship, and unfortunately, and that's how we ended up in South Africa. Yeah, but there are a lot of Baha'is all over the world, including South Africa, and that's what I love. Why I love South Africa. South Africa and South Africans embrace everyone. And this is, even though I was born in Iran, I see myself as a Persian South African, and this is one place that is giving me my new home, my new identity, and I find South Africans very embracing, and that's why we essentially everyone can practice their religions, their cultures, everything else in South Africa quite nicely. So,
what's your home language?
Is Farsi or Persian.
Okay.
So,
and is that all you spoke in Iran?
Yeah, there are lots of different languages. There is lots of different dialects in Iran, but essentially,
you growing up,
Persian is the main language in Iran.
So when you moved to South Africa at the age of 17, how was your English?
Very bad. It was terrible. Like, I always just tell the story. When I moved to South Africa, I had done grade 11 in Iran, and I came to South Africa knowing and thinking that I wanted to do medicine. And my oldest sister, who's the general practitioner, she was essentially like the mother and father figure for us at the beginning, and she still is. So she started, looking at university options, and after a while, they told us, you'll have a much better chance to get into university if you matriculate in South Africa. So we ended up looking at high school options, and I ended up going to grade 12, but not knowing any English, or like very minimal. It was hard.
Which high school was that?
It was at the time it was called Damlin College High School. I don't think
it's a privatized institution.
Yeah, I don't think it offers any high school anymore.
In Joburg or where about?
No, it was in Joburg. It was in Parktown. It was actually. So I ended up going to Damlin. I really felt bad. I was keeping my classmates behind all the time, because they had to like spell every single word for me on the board, and it wasn't fun. But I think once you are thrown in the deep end, you learn to swim very quickly. I always tell the story. My first English test in January. It was January 97, and my first English test, it was a comprehension test. They gave us a paragraph, and it was an hour test, and there were 25 questions, and I started reading this sentence, this paragraph, and I was like, I thought I understood a little bit. I started answering. As by the time I answered question 5 out of 25, the time was up. A week later, I got my result, and it was like, first one was wrong, second wrong, third was wrong, fourth was wrong. And then she gave me, I think she felt bad for me, so she gave me 1 mark, 1 out of 25. I was like, 4% is going to be a struggle for the year.
Yeah.
So yeah, I studied hard that year. And
so this was 97, the same year you came to South Africa.
Yeah, we came here in 96, and I went to school in 97. Yeah.
Yeah. Your parents, did they have any other options of where to immigrate to at that stage? What do you think made them choose South Africa?
Yeah, we had relatives here, so I think it was the easiest option for us. It wasn't that easy to go elsewhere. But I still love the place. I loved it from the beginning, and it's one of those decisions that are really happy that you made.
So why medicine?
Why
medicine?
As I said, we always looked up to my sister. So from childhood, me and my younger sister, we both wanted to do medicine, and it was one of those passions that we grew up with, and we wanted to do it. And it's it's one of those things that you set your mind on it, and you just end up doing it.
Okay, so from a matric student who's getting 4% for English, how do you get into what's the journey into medical school?
It was hard. I worked really hard that year. I ended up with relatively good marks, but it was not easy to get to med school. So I ended up doing a BSc for a year, BSc in science, and yeah, adverts as well. Yeah. So by the end of that year, my marks were quite good. So I essentially beginning of 1999, I started with med school.
I mean, I think it's worth pausing though and like looking at this. You're learning in a language that you're not fluent in, and you still get into university. So that means you were quite a bright student. How were you doing in Iran?
No, I was doing well. Like, I mean, I was always like a good student at high school and primary school. So no, I was.
There was no YouTube and Google and all that stuff to help you in those days. Right?
No, there was no YouTube or Google
Translate
at that time. No, the first computer that we used was like actually in university here.
Yeah.
So no, we're talking about.
And people didn't treat you badly or bully you and say like, when you started it, because you said people were waiting for you and having to spell things out for you. How was that matric here?
Back in Iran?
No, here.
Oh, yeah. No. We like, the one good thing about Damlin was there were a lot of foreigners, and that's actually what it was so interesting for me. Is coming to South Africa. Essentially, it was the Rainbow Nation. There were like, when you grow up in like somewhere like Iran or Middle East, I think 100% of your friends, your classmates are all the same as you. I mean, maybe different religions, but like, they essentially just speak the same language and they look like you. You come to South Africa and you find a very different story. You have people, white people, black people, Indian people, foreigners, and everyone's getting along with everyone. Everyone's like,
So it was the first time you came across a black person in South Africa?
Yeah. It was basically, I came across people of different cultures, different nationalities, and at Damlin, that was a nice thing about it. It was like a very, very diverse kind of group.
Okay.
And even though they had to, wait for me in the lecture or in the class, but they were like very nice people. Like, some I'm still friends with, and no, I had no issues.
So you were all on the same boat almost, and common
100%,
purpose. So
absolutely,
there was some patience, because I guess if you went to a normal high school, not a normal, but like one that didn't have all the different cultures and nationalities, you might have come across a different situation.
Probably it would have been a bit more difficult, but that's why we chose it.
Yeah, if I'm not mistaken, Damlin is geared towards matriculating or the matric syllabus. Do they have any other grades? Do you know?
I don't think actually their high school is. I may be wrong, but I think they are like a
private college.
Private college.
Yeah,
I think they had a private college at the time as well, but they had a school metric syllabus as well at the time.
Okay.
I'm actually not sure at the moment what's going on with it.
Yeah.
So we need to just, again, I'm sorry to like go back to this, but we need to, for people watching, you can be a person that's getting 4% in English in matric and still become an orthopedic surgeon years later. It's inspiring. I mean, I think it's brilliant. So people out there thinking, I'm not performing, you can. Okay, so you did the BSc. How long is that?
The BSc course is 3 to 4 years, but if you get good grades, you can always apply to medical school. I think the program has changed since, and but you can still do sometimes a year or two of BSc. And
how long did you
apply? Sorry,
how long did you do your BSc?
I just did it for 1 year,
and you were doing really well, so they bridged you.
I did relatively well, and then so I applied and I got into medical school. Yeah.
Okay.
So for the first year, I got a lot of my credits from the BSc year, so I started properly with the medical school from second year.
Oh, that's great. And how was med school? Any memories? What do you remember from?
Yeah, medical school is
med school?
Always.
It was adverts?
Adverts, yeah. I did everything adverts, BSc, medical school, and my specialization adverts. Medical schools, it's...
We don't.
You don't know? You did dental school, so...
What do you call a doctor that never went to med school?
Dentist?
Yeah. So we don't know. Tell us about med school. What was it like?
No, med school was challenging. I think that's... even if you're doing well at high school or primary school, and you think you're doing well. You come to med school, and all those people who are doing well are now your classmates. And all of a sudden, you think you go from a very, top performing student to someone who is become very average. So it was challenging. It was hard work. But the thing is that, we grew up, in as a kid, in a country that there was a lot of persecution with a lot of challenges. So, you're used to it. You are here to work hard and to get where you want to get to.
Was life here easier than in Iran, or can you compare?
As I said, in South Africa, we don't have a lot of the challenges that we did have back home. And a lot of them, again, go back to that religious persecution, So, yes, you don't have to worry about getting kicked out of school. You don't have to worry about, your your father being in prison because of his religious persecution. You don't have to worry about, a lot of those sort of things. So, you can focus on your life and your work and your career, etc. So, and you are being treated like everyone else. So I think from that point of view, it was much easier, I would say. Yeah.
Yeah. And if you take us back there to Iran, I'm interested in what was it like growing up there? What town or city did you grow up in?
Yeah.
And
So
what was it like?
I was born in Tehran, which is the capital. We grew up in a small town called Gombad, which is in northern part of Iran, and
is that bordering the Iraqi border?
No. Iraqi border is on the west. So this is on the north of Iran, near the Caspian Sea. I have fond memories from my childhood. My father was in prison for 5 years, again based on our religion. So I was 4 years old when he was thrown into prison.
Wow.
And until I was 9. A lot of my friends weren't so lucky. They were killed. Their parents were killed. But my father was in prison. We as a community, we had a very close knit community, and even though it was hard, it was. As a child, you always think back and you always remember the good, stories, and you don't remember those hard moments, but yeah.
And what did your parents do? Were they part of a medical background?
No, not at all. Actually, my father. He's actually, my parents still alive, and they live in Joburg. My father was essentially a farmer or like a landowner, and again they took away all their belongings because of their religion. My mom was a housewife, and that's essentially, mom. I've got 3 siblings, 3 sisters, 2 older than me and 1 younger than me. And so we grew up in that northern city, and we moved to Tehran, which is the capital, at the age of 13. And then 3 years later, I moved to South Africa.
Yeah.
So you mentioned the thing about, as a kid, you remember all the good stuff. Now I'm going back to med school now. Maybe you're only remembering all the good stuff. Was there any bad things about med school?
Med school?
Yeah.
Not. You know what? I'm also a very positive person. I tend to forget the bad things. I can't even think about the bad things. I always remember the good thoughts, the good memories. It was hard, but it was fun. Your student days are the best days of your life. Even though it's med school and it's hard and you have to study hard and you don't have a social life and but you think back and say like, those days were the days.
Yeah.
So
when were you a undergrad med student from 2000?
From 99 to I graduated in 2000. And, it's so long ago that you kind of forget. In 2005, this year is going to be our 20th basically anniversary of like we having a medical school reunion.
Okay.
At the end of this year.
How many orthopods in that group?
Good question. I don't know. I must count, but there are quite a few.
And are you still friends with a lot of those people?
With the medical school? Yeah. A lot of them are my friends from back then. A lot of them are colleagues. We some went overseas. A lot of them are around. Now we have formed a WhatsApp group, essentially to organize that reunion, and people are coming back from all over the all over the world. You can see some of them are Australia, some of them are in Europe, some of them are in the US or Canada, but majority are actually in South Africa. Interesting enough. Some I work with as other specialists, and some are the general practitioners, and so there's a lot of them are. My sister was from the same class, so we hang out quite a bit still.
Is your sister also a specialist though?
Yeah, she's a radiologist.
Okay. Oh, that's convenient. So we've got an orthopedic surgeon and a radiologist.
Yeah.
You guys work together quite a lot.
No, she basically does a mammography practice. So we completely separate fields.
Okay. All right. And you live in the north of Joburg, I'm assuming?
Yeah, in the Sandton area.
That's where. And where did you do your op?
I did my op. You wanting me to disclose my confidential information? No, I'm keen to disclose anything. It's fine. How I got to be treated by Dr. Eshraghi is I went on Google and I searched ankle surgeon near me. And you were the first guy that popped up because I'm based in Sandton.
If you don't mind, can you tell us more about that? Like what happened? What were your symptoms? What made you? Because normally it's a referral. If you're feeling something funny, you go to a doctor or physio or whatever, they would refer you to someone that they know.
Yeah.
Yash, on the other hand, will go on to Google and figure out who's the best.
Yeah, so I'm not one of those patients that like self-refers and stuff. But what happened was to answer your question, so let me look at you. I mean, I'd had this ankle pain for like over a year almost. I thought I just sprained it doing a steep incline walk. And I'd been to podiatrists and I'd been to physio, and I felt like, nothing was helping it. So that's why I was at my wit's end to say I need to actually go to an orthopod. And I think one of my wife's parents, who are also specialists, they said, go to an orthopedic surgeon. And that's what made me Google ankle surgeon specifically near me. And then I went to...
Oh, so you went directly to a surgeon? You didn't go to a physician or anything?
Yeah, no, I went directly because I'd been all the other routes. So, and that's the beauty of being in South Africa, by the way, because I work with a lot of UK-based colleagues, and some of them are ex-South Africa expats, and they say to me the one beautiful thing about South Africa is that you can go directly to a specialist if you want. You don't have to go through the whole chain of GP and then wait. But no, we skipped too much here. I wanted to get to that later. We were at med school, so med school to you, see, obviously you breezed through that. It's a 6-year degree, right? Adverts.
Yeah.
And then, did you have to do community service also? Internship in ComServe?
Yeah. So you do. These days you do 2 years of internship. I was the last group, part of the last group who did 1 year internship. So I did my internship at Helen Joseph Hospital, and then I went for my community service to Clarkstop, which was very, very nice because there's a lot of hands-on in that hospital, and I learned a lot of orthopedics in my community service year, and I stayed behind an extra year, so 2 years in Clarksdorp, and I came back. I did medical officer time in at VIS again, and then I got into my specialty in 2010.
I know a lot of the students do a rotation through Clarksdorp in their not their final years, even in the internship, and there's phenomenal feedback from that circuit. And well, it sounds like you got very lucky getting ComServe there in Clarksdorp.
Yeah, so I always as I said, I always knew I wanted to do orthopedics. So I requested to do my ComServe in orthopedics, and they said you can do at least 6 months. So I started in orthopedics from the beginning, and right through I just did orthopedics in my community service. So I started operating and getting exposure in orthopedics from community service days. Yeah.
You were mentioning Bara in the story about. So how do you? Because you mentioned Helen Joseph is where you did your internship. When do you get exposed to Bara, Chris Hani Baragwanath Hospital?
So basically, as students, you rotate through the 3 hospitals: Baragwanath, Joburg Gen or Charlotte Metzger, and Helen Joseph. So you rotate through your clinical years in those hospitals. So you get to experience different medical fields. So you do internal medicine, you do surgery, you do orthopedics, ENT, in different rotations, essentially, different hospitals.
Okay.
Yeah. So if I can ask, you didn't have to do that. You kind of stuck to orthopedics.
No. You when you are in medical school, you do everything, and that's when you become that's your undergrad, and then you write your exams and you become a medical doctor. Once you're a medical doctor, you do your internship, and in internship you actually have to rotate through different specialties. And then you do community service. So you can do a community service in a bigger town or smaller town, or a bigger hospital or a smaller hospital, and you could still rotate through different specialities. But I just managed to get into orthopedics, and I studied in orthopedics, so that's what they needed.
Okay, so, that was in Clarksdorp.
Yeah, in Clarksdorp. Yeah. But as a medical doctor, you have to be exposed and be able to have the basic knowledge of all specialties, and to be able to do your exams, and
So. Okay. And then I don't know if I'm skipping forward at all here, but when did you decide to privatize, step out from public?
So when I did, once I was done with my specialty as an orthopedic surgeon, I looked around different fields, and I came across foot and ankle surgery. And I saw that, there were a lot of other super specialists in different fields, like hips and knees and hands and shoulders. And so there weren't as many specialists in foot and ankle surgery. And some of my good colleagues or my mentors, they were foot and ankle surgeons in town. So basically, I approached them and asked them if I could do a fellowship with them. And they were kind enough to share their knowledge and their expertise with us. And once I'd done my fellowship with them, then there are usually 2 choices: either to get into a public setting or a private setting. So there was an opportunity for me, and I started my private practice in 2015.
Okay, but to super specialize, you still got to go through CMSA. Is that where it's registered?
With the super specialty.
Yeah.
In other specialties like internal medicine and those super specialties, those super specialties, yes. In the surgical specialties, there isn't a formal program that is registered on.
So there's not a formal registration.
It is a formal program, but it's not registered. Actually, nowhere in the world you get super specialty registration on the surgical subspecialties.
Yeah.
So yes, Yak, you are skipping ahead because I wanted to talk about specializing. So after you become a medical practitioner and you do all those rotations everywhere and you do ComServe, then you get into what registrar program do you get into? What's it called? Is it orthopedics or is it general
orthopedic
surgery?
registrar program? Yes.
Okay, so it's not like a general surgical thing. It's specifically for orthopedics.
That's correct. So a lot of there are general surgery programs available as well, and some of for example other surgical specialties. They have to, for example, like plastic surgeons, and they have to do like a general surgery program first, and then do, for example, plastic surgery or vascular surgery or so forth. But with orthopedic surgery, it's usually from the beginning you go into the orthopedic surgery program, so you don't have to do a general surgery. There's a lot of like little courses that you may do together with the general surgeons. Like for example, the basic surgical skills course, or you do your exams, some of the exams together with them, like a primary exam. You can, like, that's all the surgical specialties, they do it together. But with for example intermediates and finals and the rest of the program is completely separate.
Okay. And so who's your professors and stuff when you get into the orthopedic reg program, or your consultants? Who do you work under?
So you work with there are lots of orthopedic profs and consultants at depending on where you do it. So I did adverts under some of my mentors and consultants.
Who are they? Who are your mentors? And
so at the time, Professor Lukele was the head, and Professor Ramachopa, he was the second head. And then there are like a lot to name,
Okay.
So
yeah. And then is it just, what do you do as a orthopedic registrar? Like, you just break bones every day and put wires in?
So you basically you practice your passion, So I was, again, like, some people do work for the sake of doing work or making money, or but I've been lucky to find my passion. So when I work, I actually as if I'm having fun. So being in theater or seeing a patient, it's fun. It's like, I practice what I love every single day.
Yeah.
So just answering your question in terms of what do we do, it's divided into consultations, right now, like divided consultation or theater. So when you're consulting, you are seeing either new patients or follow-up patients, and when you are in theater or when you're operating, you do surgery.
Yeah.
So you go to theater and you either fix bones, or if there's a fracture involved, or if you're doing a reconstruction work, I'll get to what we do as orthopedic surgeons or as foot surgeons, essentially. But we do a variety of things. Doing reconstruction surgery, doing if you want me to, I can actually tell you exactly what.
So you're seeing a lot of trauma patients and like motor vehicle accidents and things like that, of people falling.
Especially when you start, as a medical officer, or in a as when you are doing your specialization, that's basically all you do.
Yeah.
So there is quite an overload of patients in the in our public settings. So you don't get to do anything in terms of doing reconstruction work, or doing the non-urgent or non-essential work, essentially. So all you do every day is fixing bones.
Okay.
So
from head to toe, or is there any from head to toe, or is there any part of the body you don't touch?
So as a specialist, we there is part of the anatomy that you essentially specialize from.
Okay.
So sometimes sometimes a junior doctor calls you and say, I've got a rib fracture, can you fix it? I'm like, no, the rib fracture doesn't fall, it's a bone, but it doesn't fall under orthopedic surgery.
Who does that fall?
That's under either cardiothoracic surgeons or trauma surgeons. But as orthopedic surgeons, we start, if you want to get into details, you start from the clavicle down.
That's a collarbone?
That's a collarbone, and you do the upper limb.
You're speaking to dentists here, remember?
Oh,
please.
yeah. Sorry.
We only know max facts, clavicle upwards.
I thought you did anatomy.
Oh, barely did anatomy. I barely.
So you do from collarbone and the entire upper limb, and then there are obviously spine surgeons who do the spine, and as the rest of the orthopedic surgeons, you do from pelvis, hip, knees, femur bone, all the way down to the toes.
So it's like that Sealy Posturepedic advert, the hip bones connected. All those bones are orthopedic surgeons involved in. Okay, cool.
I wanted to touch on something, right? So, I mean, there's what do you want to call it? A stereotype that we're like failed doctors. But when you watch Scrubs, have you ever watched Scrubs?
I haven't.
It's a series. It's a comedy. But also you see memes and things like that. There's a stereotype that the orthopods are like the jocks of the specializations. Is that correct? Is that what you guys are seen as from the anesthetists and everybody else?
As I said at the beginning, unfortunately, there is a bit of truth to it. So, we all doctors at the end of the day, we all go through the same program, and sometimes, you start practicing as a holistic doctor, and you try to be the holistic doctor, but at some stage you end up, focusing on that bone.
Yes, you're doing what
that sometimes you forget about the other part. So we always have that running joke in theater with my anesthetist that you forgot to check the patient's heart, but we try to, but at some stage you forget that stethoscope at home, and you don't use it that often.
Yak actually reminds me of something by bringing that up. So when I Googled you, right, and I came to your website, I remember. Now, I'm a lay person, obviously, even though I'm a dentist. So I do have that preconception that I'm going to be now consulting with one of these, orthopedic surgeon types. And I remember, like, the photos on your website, you do look quite intimidating also. I think it's like like the camera angle is a bit lower.
Yeah, it's folded.
I think so. I can't remember. But then, so when I was preparing myself to consult, and you guys won't think of this because you see patients every day, right? But now, patient to come to you, it's a big part of their life. Like they've got to take time out of their job. They've got to think, oh my goodness, is this guy going to just, look at me and not? And I'll never forget my first consultation with you. And this is a plug for you, right? So you examined me, you sent me down for x-rays, and then I came back up, and this sticks with me. And I even went and gave you like a 5-star Google review because of this after my treatment. It's like the first thing you told me was you didn't try to make it seem like you knew exactly what was going to be done. You said to me, Yash, I mean, this is the first time I've seen a lesion like this so ginormous at somebody your age. And what I want to do is I want to consult with some of my senior colleagues and maybe my international colleagues and get back to you. And I know a lot of doctors, a lot of clinicians think that by doing something like that, the patient might not trust you, because they might think this guy doesn't know what he's doing. He wants to speak to somebody else. But ever since that moment, that was when I trusted you fully, because I said, this guy's not trying to sell me a procedure. He's telling me I actually need to consult with my colleagues. And you could have done anything else wrong afterwards. I still had your trust. So you also, your calm demeanor and the way you dealt with me, and the way I'm sure people can pick it up now in this conversation, it's totally against the stereotype of the jock type of thing. So, any comments about that?
Well, firstly, though, is ginormous a medical term?
He's got to break it down for a layperson, right? Yeah.
Now,
you know.
you're paraphrasing there.
So just to tell you, like, I actually get my calm demeanor from my mom. From I mean, my mom is my role model, like, in life. She is the calmest person, and I think all that uh, um I'm getting from her. Just to get back to your comment about my uh, the profile picture on that on the website, there's an interesting story to it. When we started practice, and especially with doctors, there is a thing about not to advertise yourself. We actually, even by HPCSA
It's a
rules, you're not
regulation.
supposed to be advertising. But it's 2025 now, and like, people are supposed to know about you. They're supposed to have information about you online. So you are allowed to have a website and tell people what you do, and you're not supposed to tell anyone that you are the best in your field, but like, you can tell everyone what you do. So for years I was meaning to do a website, and before COVID, things were so busy. You're running around every day, and like, you have no time to do anything but work. And then COVID happened, and who breaks bone while you're
Sitting
at
at
home?
home, yeah.
So you're at home.
When you're not drinking, a lot of people weren't drinking.
Exactly. So you're sitting at home, and like, you go for odd case here and there, and you do, like, you see a few patients here and there. And then I had lots of time, so I was like, okay, best time to do a website. So a few months later, I contacted the person to do a website for me, and then he started. He sent someone with a camera to do some pictures. I did. I went and did a few pictures, and he sent me a few weeks later. He sent me the pictures and said, "You must choose pictures." I'm like looking at these pictures. I'm like, do I really want to choose from these? And then so I left it. Next thing, he sent me a website, and then he chose his own pictures, and like, and ever since I was like so lazy to go and choose a different one, and my couple of my friends always laugh at me and said, "You must change that profile picture." I was like, sure, I'll do that soon. But you're right, it looks so intimidating and like so angry, and like but that's where the picture story comes from.
Okay.
But I try to be a little bit more friendly compared to when it comes to the
No, but that's the funny thing, right? It can go both ways, because
Yeah.
a lot of patients want this super confident, type of surgeon, and others might. So it can go either way, right?
Yeah.
Clearly, it's not deterring patients from coming to you, so it's working.
I think I think confidence comes from being comfortable, with what you do. It's just if you are, if you love what you do, if you're comfortable in terms of what you do, um, uh, at the end of the day, I don't think you can sell yourself by uh, self-promotion. I think if you do what you do properly, it comes across. I think, and that's what I believe in.
Yes.
I don't, unfortunately or fortunately, I don't do social media that much. I don't have a Instagram page about my website, about my
Practice.
my practice, and but it usually goes by word of mouth, and that's how I've been doing it ever since.
Yeah. Before you move on, just looking at this like from a holistic perspective, like Yash mentioned overseas, am I correct that you cannot approach a specialist directly? You've got to go through an intermediary.
Yeah, in some places, you got to go through a GP and a referral process and things.
Yeah. So, I mean, I find it interesting that he came directly to you, and then you had to kind of diagnose what was going on first, and then surgically treat also at the same time. It's not very common that happens in South Africa. I don't think so. Or is that something that you do routinely, diagnose and also treat?
Actually, it is quite common. there are some medical aides, for example, who have that rule that you have to be referred to a specialist. But in South Africa, we don't have that the general rule that the referral has to be coming from a general practitioner or another colleague. So self-referrals make a huge portion of my practice. And these days, again, with like back in the day, if you had to go to someone, you had to get referrals from someone and say, do you know an orthopedic surgeon? But I think, again, times are changing. There are all these WhatsApp groups that, people don't go to a GP and ask who should I go to. They go to the area WhatsApp group and say, I need to go to an orthopedic surgeon or to a dentist or to, a plastic surgeon. Who do you recommend? And I think often they take advice from their friends, their family, and as you're in practice for a number of years, you end up seeing your patients' family members, your patients' friends, your patients' cousins,
based on referrals.
the siblings, and that's how you often grow your practice. In terms of my patient base, there's a lot that come from general practitioners. I do foot and ankle surgery, so a lot of podiatrists refer to us, a lot of physiotherapists refer to us, and sometimes a lot of orthopedic surgeons refer to us as well, because it becomes a super specialized field. So, but it's a mixed bag.
Yeah, so I'm batting his hand away because I just have a follow-up question with regards. Sorry, it's clinical. What was your confirmatory diagnosis like with his case, if he's allowing us to?
You won't remember? How would you remember?
No, but what I'm getting at is, I'm assuming you would have had to refer to a radiologist to do some form of CT or whatever it is, because he didn't come with all of this.
Yeah.
You would have needed to go and get a report from a radiologist, who knows, maybe your sister.
Again, so, I think in terms of Yash's diagnosis,
I'm happy for you to share.
Again, that's not that he's a dentist, he's a lawyer worse than and he's a patient. So I don't know if I want to.
You've got full permission.
If you want me to go into details, but we always, when we examine a patient as any doctor or essentially as an orthopedic surgeon, we do the history and we do the clinical examination. And after that, we do our special investigations. And often we do an X-ray, as a simple X-ray to give us a lot of information. And I still remember when I sent Yash for an X-ray, I was quite horrified looking at, we do see that sort of pathology all the time. But as he put it, that was a ginormous lesion in wherever it was. It was like quite striking. So
I might share images in the video, like of my X-rays and stuff.
Sure.
That's cool. But I wanted to ask you a totally off the topic question now. When you operate, do you listen to music? Do you play music? What do you listen to, if so?
I'm smiling because my main anesthetist is I essentially ask her every day of the week just to play music for me, and she doesn't like to. She's not big into her music, but I love to listen to music when we operating. Okay. So surgery has to be a like a very peaceful environment, so you want to be at your best. When it comes to foot and ankle surgery, a lot of operations are done sitting down. So we're sitting down, we are very relaxed, often patients ask me, Doc, did you have a good night's sleep? I'm like, yeah, absolutely. I like I slept like a baby. We focus on that case, and music actually makes me focus. So if sometimes we listen to just the radio, one of my other anesthetists always brings a speaker and he's got a nice playlist, and he plays what we listen to.
Okay, so the anesthetist is in charge of the music.
They're not in charge of putting the patient to sleep. They're in charge of music, number one, and then putting the patient to sleep at number two.
And then the iPad, playing on the iPad.
That's very unique, because normally it's the anesthetists that don't really care about what's been playing. Yeah, they're generally very apathetic about what's on, and very judgmental.
Depends. Yeah. I think certain, especially some of the old school surgeons, some want absolute quiet. You can't do anything in the theater. No, I think with us is a bit different, So, and some surgeons choose their own playlist. So it has to be all about that old school surgeon. It has to be like either classical music or this music.
That's what I was going to ask. Are you into hip hop or something like that? Or?
No. I'm not into hip hop, but I'm easy in terms of any calm.
And how do you prepare yourself? Do you have to mentally prepare yourself for surgery, or it's just ingrained in you?
I think after a while, I've been in practice in my private practice for over 10 years now. So a lot of it becomes repetition, so you still focus, you're still focused, and you do your, you pay your full attention to every case, but you've been doing the same bunion surgery, hundreds of times. So it doesn't really phase you anymore. So you have more challenging cases sometimes that you have to, be more prepared about. I always read up on a lot of my, if it's a surgery that I haven't done for maybe a couple of months, always read up on it beforehand. I always prepare myself. I tell for example, the reps that coming from the, bringing the sets or whatever else.
What sets?
We have a lot of implants in theater that, they bring the plates and screws and stuff. So they need to be prepared as well. I tell them to go read their surgical, technique beforehand. You need to be prepared. I'm always prepared.
Do they give you any of the simulation kits that you can practice on at home and stuff?
I think it's we are past that stage now.
Oh, really?
Yeah. I think if you are practicing at home, you shouldn't really be doing that.
Okay.
So yeah, but sometimes you do watch that clip on the surgical technique or whatever, for a case that you might have not done in a while. So because that's the interesting thing about my field, if you're doing hips and knee surgeries, you're essentially doing the same thing over and over again. When it comes to foot and ankle, there is a lot of variation.
Okay.
So you do one day you do this, the next day the common things you do all the time, but there are sometimes when for example you came with your issue, it was very different to someone else's procedure. So
and how do you make sure you're working on the correct foot or ankle?
Oh yeah, that is a real thing, So when patients come for surgery, they get asked at least 50 times about is this the correct side? Is this we don't say right side or wrong side. We say right and left. So we mark the limb, because it's mistakes can happen. You have a busy day. You have 6 cases on your list, and days are busy. People can get busy, and so we have things in place to make sure that you always operate on the correct side. We always mark the limb beforehand. We prepare the limb. We have what we call basically the procedure is being double checked, and surgical pose, and the anesthetist usually checks, the sister checks, the surgeon checks, and so there are.
So you have systems.
It's almost like a pre-flight checklist.
100%, yeah, and you do that a good few times to make sure that mistakes should not happen. Yeah.
But I guess unless you're doing an amputation, the worst that could happen is you open up and then you're like, oh, we're not finding anything here. Let's just close it up.
Yeah, but then that's not going to happen. No.
And your patients are from Sandton. Your patients are all Sandton.
No. A patient from Sandton or from Limpopo or from Zimbabwe or from Iran. Every patient is important, and you have no legs to stand on if you
pun not intended.
Yeah.
But the point I'm making is I get it that all patients are equal, right? But surely, and you have to agree with me or disagree with me, in an upmarket area like Sandton, you're going to have patients that are asking you questions like, "Doc, did you sleep well last night?" Or, things like that. You wouldn't get that question if you were in a rural area somewhere.
I mean, there are at the end of the day, pathology is always different, and the way you treat your patient, no matter where you are in the world, is always the same. But the questions sometimes can be a bit different. In private practice, you always get the question, Doc, how am I going to be flying with the plate and screws in my head? Can I get past the airport? And you may not get that, at the state hospital. So, but those are the little differences. Okay. But everything else is exactly the same.
Okay.
Yeah.
And what's the longest procedure that you've done?
My kids always ask me the same thing. Dad, what's the longest procedure? I'm like, I don't remember, to be honest. Maybe 5-6 hours, but I don't.
Non-stop for 6 hours.
Yeah. I mean, that's not bad. I mean, there are some specialties, general surgeons who sometimes have to operate the whole day in one case. So, I mean, most of my operations are, actually there's a variety. There's operation that you do for half an hour, the operation that you do for 2 to 3 hours. So I hardly do anything that goes beyond that.
So from 30 minutes to 6 hours is your...
But there is, as I said, we do different procedures and, different lengths of time, etc. Yeah.
Do you have any favorite procedures?
Favorite procedure? Probably the operations that I do more commonly, things like Achilles tendon repairs, bunion operations, but ankle fracture fixations. But I actually enjoy all my surgeries. Yeah.
Bunion removals, that's more soft tissue. Am I correct? Or is it anything to do with the bone?
No, it's a combination of bony and soft tissue work. Yeah.
Okay.
Yeah.
All right. And then how many bones are there in the foot?
So basically there are 28 bones in the foot, and if you count those small ones as well. And now I see we're getting to dangerous. Feels like you're going back to anatomy, and I'm going to be oh, I didn't prepare my anatomy.
This is the anatomical part of the segment. Which is your favorite bone?
I mean, so Yak had a procedure on his. I don't know if you noticed, he's wearing a glove.
Yeah.
Yak,
I thought it was a fashion statement.
Yeah, well, that's what. Exactly. I mean, his head is. I mean, Yak, you can talk about that.
Yeah, I mean, look, I had frostbite about 2 years ago now. I had to have an amputation done by Roger Nicholson. Do you know him?
Yeah, I know of him. Yeah, I don't know him personally, but yeah.
Yeah, that's what I was saying. It would be great to have you guys on the show and have a standoff, which is better, foot.
You've adopted a very serious tone all of a sudden, Yak. I don't know.
Oh, really?
Yeah.
Okay, I'll try and be more lighthearted. But I had I had no idea about any anatomy of the hand. I know the phalanges, and that's from friends even, not even from anatomy. But subsequent to my amputation, that's when I started knowing about joints, especially my especially PIP and my MCP joints. But it's so fascinating for me how a joint can make such a big difference to your quality of life.
Absolutely. Yeah.
And I see it with my foot because unfortunately, at the same time that I had my amputation, there was a teammate of mine that was climbing the same mountain. He had a foot amputation. Well, parts of his joint of his foot.
Right.
And it was so minimal. And I saw him in recovery. And even now, he's got a major limp that's happening. And he only lost about 3 to 4 toes not even all, just like a partial amputation on his right foot.
Even losing one finger or like half of a finger. You often take things for granted, when it comes to your anatomy or your body, and people really don't appreciate, what your God-given, uh, healthy body until you don't have it anymore. And the same thing goes with like after surgery when you go into a cast, or like you don't have the one arm or one hand or one wrist to use, for a few weeks, and then you see how you struggle for those few weeks, and then you start appreciating it more.
You've summed it up 100%. I mean,
Yeah.
after my surgery and I was in that cast, I appreciated mobility so much more. And I've said, like, how do people that live on their own and that have these conditions, how do they deal with this? Because, I mean, just taking a shower, just getting out of bed, small, tiny things makes a huge difference. Anyway, should we move on? I mean, what do you do?
We both sounding like people that have just come back from the war here. So,
So what do you do for fun, Doc?
Oh yeah, doctors are usually very one-dimensional people. Like, that's what you hardly find doctors who want to retire, because they have all their lives they've been working, and you often don't develop anything to do once you retire.
No time, right?
So and that's when it hits you in your mid-40s that wow, life is going fast, and like all I've been doing is either studying or working or doing calls, and then you start, maybe I should start living life a bit more. So in terms of fun, I really, first of all, I really enjoy spending time with my family. I've got 2 boys, 10 and 12. And so
Any broken bones yet?
luckily not. Yeah, so I spend time, I really enjoy time with spending time with my wife and boys. And so whatever opportunity we find, we try to either go on holiday or get away, or just, have fun at home. But also, I enjoy my sports. I do a bit of running, and I play padel. I used to play soccer when I was younger. I actually ruptured my ACL in my 20s, and I had it repaired. And after that, I still went back to play soccer. And every time I was going for soccer, my wife was like, "Please don't rupture anything, don't get injured." And I was like, you go with so much fear to play soccer, and then COVID happened, and we stopped playing soccer, and then padel started. So we often play padel like twice a week.
Who do you play with? Like,
with a bunch of friends, a bunch of friends, some colleagues. You need 4 people. So I'm admin of my paddle group, so it's my responsibility to find people. So every Thursday, every Sunday, we go and religiously we play our paddle, and we do see a lot of paddle injuries from.
That's what I wanted to get at. Like how because I've heard from my physio that practices that were otherwise, just on par, not orthopedics, but from the physio perspective, all these practices are starting to boom now because of paddle.
Yeah,
and obviously
so
subsequent referrals to you guys.
as a foot surgeon, I see a lot of Achilles injuries, from paddle these days. We used to see a lot of Achilles injuries, but they were mainly from soccer or tennis, but now it's majority all paddle related. But you still you have to live life, so you still have to go and try to avoid that drop shot. You can have the point, and I'm happy to give it away. But I still play my paddle, and I do my my runs, and I go for park runs every week. Try to go every week, and try to live a healthier life. So compared to my 20s and 30s.
Are all your friends medics, or do you have like a diverse bunch of?
No, I've
Are you
got
married to a doctor also?
No, my wife is not a doctor. But and I've got you end up having a lot of medical friends, but no, I've got a mixed bag of friends. Actually, these days, most of my friends that I hang out with are non-medics.
Okay. And do you enjoy people? Like, are you a people's person?
I definitely am. Like, I think when it comes to you tell if you're a people's person or not if you have a choice between writing an email or making a phone call, and it's always, for me, it's always making a phone call. So
okay.
like
you've just confirmed that I'm not a people's person. There's another thing that really stuck out with me. Like a few weeks ago, I was at a park with my family. I think it was Mother's Day or something like that. Yak was also there, and then somebody from behind me says, "Hey, Yash," and I turn around and I see it's you. Right. And then we speak and we greet and you ask me how's my ankle and all that stuff. And what the part that you don't know is afterwards, I went to my sister because I introduced you to my sister who's a surgeon. She was there. And I said, you see, most doctors I know would never go out of their way to greet a patient like in a random public space. And it was like, it was so cool. This guy, he didn't have to because I wouldn't have even known if you walked past. And that told me that you are a people's person. Like, Yak, I don't know if you agree with me, but a lot of
No, of course, definitely. I mean, sometimes with me, when I'm walking in Woolworths and I see someone, and it doesn't have to be a previously, uncomfortable situation or interaction, but just the energy. I don't want to expel that energy now, especially to explain, what am I doing here? Like, am I a human? But also that day at the park, I thought Yash was harassing you because I was on Overwatch.
You know what? It's funny that you mentioned, because my wife always laughs at me and said, every time we go to a mall, you always find someone that you know, and you always like end up going to the other side of the mall and to greet them. So like, it's I enjoy friends. I enjoy hanging out with friends and always connecting with people. It's interesting. We were in Australia. My wife's family live in Sydney, so we were in Australia a few months ago. We were walking downtown Sydney, and we and also I'm like good with I'm bad with names, but I'm good with recognizing faces. So in the middle of it was during New Year time, and in the crowd in downtown, I saw like a face that I was like, wow, I know this face. I go closer, and looks like our Olympic swimmer Tatiana Smith. And I was like, I know that face. I'm looking, like, that's Tatiana. So I go back and say, Tatiana, like, can my kids have a picture with you? And I think she was very like shocked that someone in the middle of this crowd. I mean, obviously she's an Olympic swimmer, and everyone needs to recognize her. But like I think she was very surprised that someone saw her. And then 10 minutes later, I was walking and I saw one of my old classmates who emigrated to Australia like a few years ago. And I was in a very random setting, I saw two familiar faces. So I'm just, sometimes you're good with those sort of things. You recognize faces, and obviously you enjoy communicating with them. So
it was clear to me that you're a people's person, because there's a risk that comes with greeting a patient. Like, I could have said, "Hey, doc, you know what? I've got this problem now. It's been troubling me." And
no, you're not. You're not a random patient. You're a very dear friend.
Okay, that's cool. No, that's awesome. So, look, I know the answer to this question. Obviously, like there's no regrets of you having done medicine. You knew you wanted to do it. You've always done it. But here's the question that we usually ask our guests on the show, is that if somebody, and now that you've mentioned you've got two boys, 10 and 12, when they get to matric, or that time when they're going to be figuring out what their career is, and they come to you and say, "Dad, I want to be a surgeon, or I want to be a doctor," what would you say to them?
again, like, I think, it happens a lot that, your kids either get really pushed by you that they need to be doing something, or you kind of deter them from doing that thing. I think of myself as someone quite liberal and quite open-minded about it. If I would never push them to go after my career, or to go and do whatever I did, and I'm not going to say no, you shouldn't do it either. So if they come to me and say, we want to do what you did, or we want to do it what our mom did, and I'll say with pleasure, you must go and do it. If I think we as parents, we need to guide them, and give them all the information, and at the end of the day, they need to make that decision on their own. When it comes to, again, like, there are some of my colleagues who regret them and say, like, in medicine, you work all these years, you put all the numbers and the hours, um, and you could have done something much easier, shorter time, like less effort, and
Better money.
and yeah. But if you love doing what you do, I don't think you can do years and years and years and decades of whatever you're doing to get there, and I don't think it's still worth it. So
do you think you'll ever retire? How long do you think you'll go?
Yeah, we have that discussion every week with my anesthetist as well. Like I say, I tell her, the day that you think that my hand starts shaking, and I'm not doing what I'm supposed to be doing, you must tell me, because a lot of people don't have that realization. So. I would eventually obviously have to retire if.
But you'll probably do it until you can't do it anymore.
Maybe that's not the right time. Maybe you should have a set time, but I'm happy to go until I'm 70, if I'm alive by then.
Yeah.
But I'm happy to go as long as I can. Yeah.
You're far too young, but have you ever started thinking about a succession plan? Like, how do orthopods would you get in other locums at your practice?
Yeah, I think I like to think that I'm young for that, but often what happens is that once you get a bit older, you start mentoring other people. So like how my mentors mentored us, in foot and ankle surgery. You always like to get a younger person. You start training them. You start showing them, the little bit of the. Even though you study these things, it's a lot of the practical stuff come with the repetition and practice, and it's always good to have some mentorship. So at some stage I would love to have a mentor, as someone that I can mentor, and maybe hopefully they can take over from me. I think again here I need to, maybe it's a place to thank my two mentors, Prof. Saragas and Dr. Paulo Ferro, who I did a fellowship with them, and they essentially were so kind to pass that information and pass the knowledge. And even to this day, so many years later, they're always available. Every time you need to discuss something with them, they are there. They are so generous in terms of, you find people who we told that information and we told they don't want competition, but these guys have been so generous, all these years.
Did you say Prof. Saragas?
Yeah.
Okay.
Yeah.
He's here at Linksfield.
Yes. He's at Linksfield, and Dr. Ferro. And they have been my mentors, and I'm always thankful, and I always will be thankful for all they've done for me, over the years.
Slight change of topic. I've seen you on a padel advert, I think for Discovery.
Really?
It was you, right? Yeah.
That was me. Yeah, that was completely by luck.
Do you know, I was actually going to mention this earlier, but I detracted away from it. in that I once one of my like 6-year-old patients asked me if I'm friends with the tooth fairy.
Yeah.
And then I thought that sounds a bit like corruption.
Yeah.
But padel being synonymous with ankle injuries and you being a successful ankle surgeon, and now he tells me you're on a padel advert.
No,
Wow.
that was a
Perverse incentives.
complete accident. No, one day we went to play, and they had camera people filming and taking pictures. So they asked if you mind having pictures taken. And we said no, don't worry. And we thought it was going to be a couple of shots. Next thing, the cameraman starts filming us from the front and from the back and from between our legs and from the side. And half an hour later, our entire game is being filmed. And we signed some forms. We didn't know what they were.
Yeah. You see, doctors just sign things. They don't even read. Yeah.
And 2 months later, we see we are on the. I was on the. Some
I think it was Discovery.
website, Discovery thing about it was, I think it was a CFO or CEO of they were
the CEO of Discovery, I think.
They were trying to promote the padel, and there was me shaking hand with my one of my colleagues, my friends.
Yeah.
So that was absolutely by luck and by chance.
That's why you need to read what you're signing, right?
Yeah, no, but also you intentionally told us that you're the admin of your padel group.
Oh yeah.
We're trying to make this spicy.
Oh no, but yeah. So I can't believe they made the surgeon the administrator of the group. There can't be any anesthetists on that group, then definitely, because usually
you're right.
I would make it an anesthetist. They're good with admin for some reason. Okay, cool. I mean, is there anything else we didn't touch on that you think of, or?
Can I ask you what?
Yeah.
Can I ask you just one more question?
Sure.
Do you ever go back to Tehran?
No, unfortunately not. No, this is actually funny. This is my home, so South Africa is my home. I consider myself South African. A lot of my patients, actually majority, maybe these days they know me a lot more, but at the beginning, everyone who came in, they said, "Doc, can I ask you a question?" And I knew straight away what the question was going to be, where are you from? So, I know the name and the accent and everything else may not sound South African and look South African, but I am South African, Persian South African. So this is my home. Unfortunately, no, I don't go visit for some other reasons, but it was interesting. The one time that I really felt South African was when
World Cup.
Sorry?
World Cup.
Rugby World Cup, so I had a huge FOMO about being at the last World Cup. So when South Africa got to the final, I said, no, I have to get there. So I managed to find a ticket at last minute, and I did a list on a Friday. After the list, I got on the flight, and I went to Paris. Got there on Saturday, went for the World Cup game on Saturday night. In my full South African kit, the French people not knowing a difference between a Persian South African and a real South African. So I really felt like, I was South African. But no, that's, I am, I've lived in South Africa for 30 years. I really love this country. And, I think that's one of those things that a lot of South Africans take South Africa for granted. They end up wanting to emigrate because of different reasons. We can always find faults. It's always easy to call this or that, but I think South Africa is one of the most unique countries in the world, with some of the best people. Some of the best natural beauty, some of the best food and fruit that you can find anywhere in the world. I'm quite well traveled. We often go and visit different places, But every time I come back to OR Tambo, from the friendliness of the custom people to our fellow South Africans, and unless I really, really have to, I would never say never, but I would never immigrate anywhere else in the world. But no, that's the one thing I wanted to actually. I'm really pro South Africa, and yeah. So no, this is my home.
Yeah.
This is where I'm staying, and I will be a South African for the rest of my life.
That's great. And I mean, it's I'm going to say it's so nice to have you like on the welcome party. Yeah, but there's a common perception with even our previous guests, because it's a theme that just keeps coming up, that South Africa is really warm, friendly. He once mentioned that Joburg has the best people, but it seems to be a common theme. And I think from what I get from everyone that we've interviewed, thus far, is that everyone wants to actually try and be part of. Everyone has problems all around the world, but everyone that we've had on the show thus far wants to be a part of the solution, not the problem.
Yes, and I'm so glad you said what you just said, because we are pro South Africa also. It's one of the reasons why I named this "Why Did I Become a Doctor?" South Africa. A lot of people, quite a few people have told me to drop the South Africa bit because it limits me. But I genuinely am pro South Africa, and it's probably no coincidence that the people we are speaking to on the show are also pro South Africans, because it's very easy to get negative about the country if you're reading all sorts of things. It just depends what you follow. But you've said it. You're a well-traveled person. You've been all over the world. There's no feeling like coming back home and seeing South Africans and hearing Afrikaans and all the other languages, and even you go to India and then you realize, oh, our taxi drivers are so well behaved here. When you watch the traffic in India, things like that. So yeah, I want to end on that note, because it's such a good note to end on, and really appreciate you taking time out of your day. Weekends are for family and things, and you're a busy surgeon. Truly appreciate it, and thank you so much for sharing your story.
Thank you so much for having me, and thank you for giving me the opportunity to tell my story.
It was a great story. Thanks so much.
Thank you. Thank you very much. Thank you.
Let me press stop.
I feel like I want to show you my foot now, because
Go for it.